Thanks for joining us today. I'm joined by Tony Utano, Local 100 President, Senator Leroy Comrie, who's chair of the Senate Corporations Committee, Senator Tim Kennedy, who's chair of the Transportation Committee, and my colleagues Pat Warren, who's Chief Safety Officer of the MTA, and Craig Cipriano, who's our host, who's the president of MTA Bus. We're proud today to launch a new voluntary COVID screening program for frontline employees, the first program of its kind for transit workers anywhere in the nation. Employee safety at the MTA is paramount as we continue to prepare for a potential second wave that we all hope doesn't come, second wave of this virus. By testing our workforce on a voluntary basis, we can help minimize health risk and keep employees and customers safe. This program goes hand in hand with the many innovative and aggressive actions the MTA has taken to date. We're continuing to do everything we can to identify and stop the spread of the virus and to minimize public health risks to our employees and our customers. In the first phase of this new program, our goal is to screen up to 2,000 employees a week, ramping up to 15% of our frontline workforce. We will continue to scale up in the weeks ahead. Pat Warren will provide more details in a couple of minutes, but this new program is three-pronged. First, on-site testing will be provided on a rotating schedule at field locations, including Grand Avenue Depot, where we meet today, as determined by MTA Occupational Health Services, based on data from the New York State Department of Health. Second, testing will also be offered to employees scheduled to visit a medical assessment center, there are 3 of them, or the 2 occupational health services facilities for Metro-North and Long Island Railroad. And 3, free diagnostic testing remains available to MTA workers through our existing partnership with Northwell Health Go Health. If you're feeling sick, this is the best option to get a test quickly. A reminder, if you're not feeling well, please stay home. There's no question but that the first wave hit New York and the MTA incredibly hard, and we're taking what we learned from that experience to prepare for the future. Last week, we hit the 10 million mark for mass distributed to our workforce, and almost 15 million total when you consider the additional nearly 5 million we've made available to our customers as a result of contributions by the state of New York and the city of New York. We've also distributed more than 12 million pairs of gloves, 75,000 gallons of hand sanitizer, and approximately 192,000 gallons of cleaning solution. Additionally, we're working to get ahead of the flu season by offering free flu shots to all employees in coordination with Walgreens. I want to thank the men and women of the MTA, including those here at Grand Avenue Depot today, for their service and dedication over the last 7 months. You are the heroes, moving heroes, and we're grateful for all your hard work and sacrifice. And having made that comment, I'll now turn it over to TWU Local 100 President Tony Utano. Tony.
Good afternoon, everybody. So back in May, as part of our 10-point plan, this was one of our suggestions, and I'm very grateful that the MTA now has adopted it and is putting it in place. It is very important that we test as many members as we can, as much as we can, because we want to catch those people that have the virus and are not showing the symptoms. It's very, very important because that's how this virus is being spread. On another note, we are also working together with the TA because the second wave is coming and it's here. And we need to stagger hours. We need to expand facilities. We need to do something about the lunchrooms, maybe put buses out there where the people could have their lunch in for now. And I'm going to suggest to every one of my members and everyone that works in this place, you need to wear your mask. You need to wear your mask. It's important. Okay, we need to protect ourselves. We've seen too many people, too many of our members perish here. And believe me, I don't want to see it again. And I'm going to do everything in my power to work along with Pat Foyd and the MTA to make sure that every member gets here the protection that they need and that it never happens again. Thank you.
Good afternoon. Thank you. I can't emphasize enough how important it is for our workers to take part in this program. We know that the asymptomatic spread is a very real concern with the virus. The CDC estimates that up to 40% of the infections are asymptomatic. Simply put, we all need to do our part to keep each other safe at work, and we now have this volunteer diagnostic testing tool to help protect each other. As Pat Voice said, testing will rotate on a weekly basis at field facilities, including bus depots and subway and rail yards, as selected by the MTA's Office of Occupational Health Services. They are choosing these locations based on COVID cluster data provided by the New York State Department of Health and operational priorities. Employees can also go online and check the schedule for locations, dates, and times on the MyMTA info app. Posters with very similar information will also have also gone up at all work locations, and participation is strongly encouraged. All employees will be offered a voluntary diagnostic test at each site, and to achieve faster processing, they can pre-register for a test. We urge all employees to go online and fill out the registration questionnaire before arriving at their work sites. At our medical assistance centers, we will offer tests to everyone already scheduled a visit at these locations. They can also make an appointment, and there will be also a limited number of walk-ins available. The test itself will take only a few minutes. It is a PCR nasal swab, which is considered the most accurate test on the market. It is the most sensitive for detecting COVID-19. The turnaround time for results will typically be under 24 hours under normal circumstances, and occasionally up to 48 hours. MTA Occupational Health Services Office will reach out to employees if they test positive. Employees can also view the results online by registering on the Bioreference web portal. I want to reiterate that any employees experiencing symptoms should stay home and take advantage of our testing program with Northwell Health Go Health. It is important to the sustained health of their colleagues that they do not seek testing at their workplace, but rather go to an urgent care center to see their personal health care provider. Thank you, and now I'll turn the podium over to State Senator Leroy Comrie.
Good afternoon, everyone. I want to start by thanking the thousands of transit workers across New York City Transit, Long Island Railroad, and Metro North Railroad who have worked courageously over the past few months to keep our city safe in the face of the worst public health emergency that we've faced in our lifetime. I want to acknowledge those people that have already sacrificed themselves in the service of our city and state to provide to our workers, to provide to our essential workers that transportation necessary during this period. This first-in-the-nation voluntary and data-driven screening regimen is just the latest effort on the part of the MTA and the TWU and the locals, 100 and other locals, to demonstrate a commitment to the health and safety of our transit workforce. My colleagues in the Senate Corporations Committee and in the State Senate are looking forward to continuing to work with the MTA as we try to make sure that worker safety is kept preeminent and that all of the needs of our system can be brought back to where we can get back to full ridership. It's important that we have these programs also to make sure that the workers can feel comfortable and secure about their environment as well. Safety is paramount, so I want to thank Pat Foy, Pat Warren, Craig Cipriano, Tony Utano, and the other union heads for their steadfast commitment to the transit workforce. And I want to thank our Chair of Transportation that came down from Buffalo this week, Senator Tim Kennedy, for his commitment to our downstate transit networks. It's important that we continue to work together throughout this as the second surge is starting to happen, as numbers start to come back up. It's important to remind people that if you feel sick, you should get tested. I have the COVID app on my phone. Everyone should put that on their phone as well to make sure that if they encounter anybody with COVID, you will get an alert. You should do the things necessary to protect yourself. We want drivers to stay protected more than anything, and we're working. I'm happy to work with the MTA as we continue to fight for worker protection, for safety throughout the system, so that we can get the ridership back and do everything we need to have a safe environment in New York. And now I'm proud to turn over this opportunity in this press conference to my colleague, the chair of the New York State Senate Transportation Committee, Senator Tim Kennedy.
Good afternoon, everybody. It is really great to see everyone here. And we recognize that everyone is paying attention to what we're doing here in New York, not just across this state, but here in this great city. And it's the men and women that make up the MTA, the hard-working men and women every single day that have kept New York moving and the entire northeast part of our country moving. Many of them that have paid the price with their lives for doing right by their community and helping other people. So how about a round of applause for all the hard-working men and women, especially those that are here today from TWU 100. I want to recognize Tony Utano and his team of the other labor leaders and their teams, to Pat Foy, the chairman of the MTA, and his team. They've really been exceptional to work with and have really led the country. This is the first of its kind in the entire country. And everyone has taken note of what's happening here at the MTA. And the goal is, out of the gate, to test over 2,000 workers every single day from the MTA. And that number is going to grow. And that number is going to expand. And we're going to make sure that every single worker, not only within the MTA, but across this state, that are moving people to and from respective areas throughout our communities, the ability to make sure that they are safe in their work. So truly, this is a community effort lifted up and driven by those on the front lines each and every day. And those workers are our heroes. And history is going to shine a very, very bright light on the workforce of the MTA when we look back upon this pandemic. I'm proud to stand here with all of these leaders as we talk about and tell the story about how we're going to overcome this pandemic together. So, as has already been mentioned, we're not out of the woods yet. We got to wear our masks. We've got to social distance. We've got to make sure we're practicing hygiene, washing our hands. But in the meantime, testing is so important so that we can track and we can trace and we can eradicate this virus from us once and for all. So the MTA is doing their part. I'm looking forward to our continued work together. Without further ado, it's my honor and privilege to introduce the executive chairman of Bioreference Diagnostics, who are doing the testing and are really leading not only our community here in the city and our state, but the country in that regard. So please welcome to the podium Dr. John Cohen.
Good afternoon. I want to thank Pat Foy, Pat Warren, Tony Utano for allowing Bioreference Laboratories to once again have the privilege to partner with the MTA to ensure that the frontline MTA employees are safe and healthy. And I also want to thank Senators Comrie and Kennedy for their continuous aggressive efforts to provide accessible COVID testing to their communities. Back in May, Bioreference partnered with the MTA to provide thousands of their employees access to antibody testing to determine the spread of the disease. The MTA was one of the first large public agencies in the country to successfully implement this type of widespread testing. Building off of that experience, we will now provide COVID-19 testing for the employees at multiple locations throughout the region to determine the presence of active virus. A healthy workforce that is COVID-19 negative will help millions of New Yorkers safely ride the buses, subways, and trains throughout the metropolitan region. Bioreference has now performed over 6.5 million COVID tests around the country. We've partnered with multiple states, cities, and public agencies around the country for COVID-19 testing program. However, in conjunction with the MTA, their comprehensive disinfection efforts, their temperature checks, their workplace barrier protections underscores their national leadership position in their commitment to the safest possible environment for their workforce. For over 115 years, the MTA, and the subway particularly, has been the backbone of this regional economy. Before COVID, the MTA transported millions of passengers 24 hours a day, 7 days a week. They bring children to schools, patients to work, doctors and nurses to hospitals, and millions of visitors to New York City's most iconic landmarks. In fact, it was today, in 1904, that the first subway train ushered passengers under our bustling city streets and changed New York City forever. Today, 116 years later, we're humbled to stand with the thousands of MTA bus and transit operators, mechanics, service workers, engineers, police, and fire dedicated to keeping the trains, buses, and subways moving safely and continuously. Thank you, and back to Pat.
Thank you, John. With that, happy to take questions.
Pat, if I may, what took this long to get this done?
Look, we've been working on testing throughout the pandemic. We've ramped it up dramatically. I think it's fair from March on. We've partnered with Northwell, with Bioreference, with Quest. Pat Warren, what's the number of tests that have been done? Yeah, we've done tens of thousands of tests for the MTA workforce, and this is just taking it to the next level. What we want to do is, if in the unfortunate circumstance there is a second wave in New York, that we're prepared for it and we take every action we can to minimize health risks to our customers and our employees.
Hey, Pat, I've got a couple. Have you seen any increase in cases at the MTA? What is the 7-day rolling average of daily cases, and is that up like it is a little bit in some other places of the city?
Yeah, so we are seeing an uptick in cases, although it's really very small. We're sitting at like less than right around 0.1% of our population ill at any given time, and that's like close to 70,000 of our employees out there. So it's very small, but we have seen an uptick in the last couple of weeks. And based on all of the great work that our employees are doing in wearing their masks and social distancing, and not only here but at home, we've been able to, and contact tracing and other things that have been put in place, we're able to really get on top of those issues right away and squash them pretty fast. So we feel real good about where we are in terms of trying to keep the numbers down, even though that we've seen an uptick in the city also.
Do you have a number of daily average cases, Pat?
They vary by day, but sometimes they're as low as 0. Sometimes they've gotten up into the low teens.
Okay. And then, Pat, is there any plan for rapid testing here? Because if I'm coming in, I'm a worker, and I get tested, it could take 24 hours to come back. I'm asymptomatic. I could still spread it. I know rapid tests are less accurate, but is there any plan to do that?
Yeah, so all of it is, there's a supply and demand, and there's a scientific portion of it. A question was also asked earlier, why now? The testing protocols that are out there are becoming more and more available. Rapid testing is becoming more and more available. And as those systems and those technologies become available commercially, we're going after them, and you see us doing that now.
Greg.
Hi, Chairman. Could this potentially affect the crews that get assigned during the day? Could this affect the schedules?
Yeah, look, the goal of this is to minimize public health risks to our employees first and to our customers. The goal is to have as few infections as possible. We've taken steps toward that aim from March on. Tony Utano, when he was up at the podium, spoke about additional steps that we're taking to minimize public health risk. And while we're focused on schedules and we're focused on delivering service, our primary focus right now, as it has been throughout the entire pandemic, is to minimize health risk to employees and customers.
So this is unrelated, but I'm just wondering if you can confirm the contract with Access A-Ride and share any details with us about that.
Yeah, look, if you go to the MTA website, the material is on the website. The board is going to consider and vote on it tomorrow. I think it would be inappropriate for me to talk about. You can go to the website, see the contract, see the details of the bidding process. I will say we believe it is a significant positive step forward for our ADA customers.
Pat, earlier this year, there was a lot of talk of hazard pay for workers, right? They've been through a lot throughout this pandemic. That kind of died down with as the HEROES Act was dead in the water. If you do get the $12 billion that you're asking for, will that go towards hazard pay? And if not, is maybe one of the senators can answer this? Is there any support in the state Senate to pass a bill that provides hazard pay to transit workers?
Our position has been clear, as has Governor Cuomo's, which is that hazard pay is a responsibility of the federal government. The MTA supports the passage of legislation at the federal level for hazard pay for our transit workers. And Tony, do you want to speak to it as well?
So our position is that we paid a big price here. You know, we had lots of deaths, but yet our operators, our train operators, our maintenance away people, our station people, they're all out there continuing to perform the job, and now a second wave is coming. We 100% deserve hazard pay, 100%. And the federal government needs to do the right thing right now and send the damn money here. And stop with the nonsense about a blue state, red state. We're all Americans, and we need that stimulus thing passed so we can get our hazard pay.
So in closing, I agree completely with the Local 100 president. We need stimulus funding and we need federal hazard pay as soon as possible. Thank you all.
Hello. Hey guys, we're going to do a testing demo right now. President Tony Utano is up right now.
Didn't feel a thing. Great. Didn't feel a thing. Do I need to sign in? No. That's it? Thank you so much. Thank you.
done this before? Yes. All right, got it. All right. Chin up. I'm not sure. Who's next?
She's up next, and then let me.
All right, folks, this will be Kathy Davis Baker. She's a bus operator based here at the Grand Avenue Depot. Kathy with a C, Davis Baker, standard spelling.
How are you, Kathy?
Yes. Yes.
Hyphenated Davis Baker, all right? Kathy Davis hyphen Baker.
Hey, Kathy, for 15 minutes.
Yes, like 15.
You're not gonna hurt me, right?
No, I promise.
Okay.
Very gentle.
Okay. Thank you.
You're welcome.
Kathy, thank you. Thanks very much. All right, now we've got, looks like the great Earl Phillips is stepping up
I have to. I have no choice.
Can you just give your last name?
from the TWU.
Zip code?
No, just like last name, first name.
All right, folks, Earl Phillips is the Secretary Treasurer of the TWU, and that's 2 L's on Phillips, right? 2 L's? 2 L's.
Thank you. Do I sneeze?
Everything you're about to ask is we have 6. How are you today?
I'm good. What about you?
I'm great. So we're gonna do a little bit. Let's raise the glass.
All right, we've got 2 more, folks. The senators, starting with Tim Kennedy. Tim Kennedy from Buffalo has joined us. He's about to get tested.
Good. So please write your last name, first name, and your date of birth.
You got it. That's all you need.
That's all.
And next, we've got your Senator Leroy Comrie right here, who will be the last volunteer this afternoon.
Can I put my address or no? You started right.
The senator is the chair, of course, of the Committee on Corporations, which has oversight of the MTA. So we're going to be very careful with that swab, all right? All right, everybody, thanks so much. Appreciate it. Have a great afternoon. And thanks to Bioreference. Thanks very much.